Good afternoon, and I'm State Representative David Silvers. I represent House District 87 in Central Palm Beach County. And I want to thank you for attending online today for this mental health Zoom webinar with UCF and FMHI. Today we have an unbelievable group of panelists with us today. We have Dr. Kathy Moore from the Florida Mental Health Institute at USF. We have Dr. Karen Hoffman, who's the Director and Licensed Psychologist at UCF at the University of Central Florida. We also have Dr. Michael Jacobs, the Assistant Director of Clinical Services and Psychiatry at UCF Student Health Services. We have Ms. Tamara Nelson, correct? Tamara, I apologize, Tamara. A staff therapist at UCF CAPS. And we also have Ms. Anne Marie Palmer, the Associate Director of UCF Student Care Services. Thank you so very much for coming here today, or being available today for today's mental health Zoom webinar. Really geared towards college students, not just at UCF, but college students from all throughout the state. So I want to, before we go on, I do want to provide a little bio for all the panelists online. So if you haven't participated or viewed any of these webinars in the past, it's an open flow. If you have some questions, please feel free to provide those questions, and we'd be more than happy to present those questions to the panelists and answer those questions. And at the very end, online, those that are viewing this, there will be a resource slide at the very end, so please stay on and you'll be able to see it. And if you have friends that would like to see this Zoom webinar at another time and aren't able to view it live, it will be on a YouTube channel, and all that information will be on the resource slide at the very end. So a little background about myself and why I'm hosting these Zoom webinars. I've done several of these throughout the state of Florida, at Florida Atlantic University, University of South Florida, University of Central Florida now. My focus has been on mental health in the legislature in the past 4 years. I've passed 4 pieces of mental health legislation that speak directly to the Baker Act with minors in our school system. And it's become a focus of mine, and it's something I'm extremely passionate about. And during the times of COVID, I've recognized that mental health is an extremely important item and that needs to be addressed. And I would like it to be a part of the open dialogue for people to openly talk about getting help if they need help, or if their friend needs help, or their family member needs help. And there shouldn't be a stigma associated with doing that. So thank you so much. I see we actually have quite a few participants online right now. And I'm going to go ahead and give a quick little run through of all our panelists, and then we start answering some questions for those online. Dr. Kathleen Moore is the Executive Director of the Florida Mental Health Institute and Research Professor in the Department of Mental Health, Law and Policy, both located within the College of Behavioral Community Sciences at the University of South Florida. FMHI provides behavioral health support statewide for many organizations and institutions. And for the past 20 years, Dr. Moore has collaborated with community-based agencies focusing on research related to improving mental health and substance use outcomes among vulnerable populations, including those in child welfare, criminal justice, and at-risk youth and adults. And Dr. Karen Hoffman is a licensed psychologist and director of counseling and psychological services, otherwise known as CAPS, at the University of Central Florida. She received her bachelor's in arts in psychology from the University of Texas in Austin, and both her Master of Science in Educational Psychology and a doctorate in counseling psychology from Texas A&M University. She has over 20 years of experience in collegiate mental health and working in college counseling centers. She was an associate director and then director of training at UCF for 7 years, has been director at UCF CAPS for the last 8 years. She's been at UCF for a total of 18 years. That's correct? Yep. So make sure hopefully I added up the numbers correctly. Her areas of expertise include individual, couples, and group therapy focused on relationships and family issues and interpersonal process, trauma recovery, identity, and sexual orientation development, and social justice issues. Dr. Michael Jacobs is the Assistant Director of Clinical Services in Psychiatry at UCF. He graduated summa cum laude from George Washington University with a Bachelor's of Science in Public Health and a minor in Psychology. Dr. Jacobs completed both residency in general psychiatry and a fellowship in child and adolescent psychiatry at the University of Miami Jackson Memorial Hospital. His professional experience includes working at the Miami VA healthcare system and also at the Orlando VA Medical Center. Dr. Jacobs is board certified in psychiatry and child and adolescent psychiatry by the American Board of Psychiatry and Neurology. He's assistant professor of psychiatry at UCF College of Medicine and is passionate about working in college mental health at UCF. Ms. Tamara.
Yes.
Thanks. Sorry. Nelson is a staff therapist at Counseling and Psychological Services, otherwise known as CAPS, at UCF. She received her bachelor's degree in psychology and master's degree in mental health counseling from UCF. She is a licensed mental health counselor within the state of Florida, certified clinical trauma professional, and registered yoga instructor or teacher with the Yoga Alliance. Tamara's clinical focus includes trauma and abuse recovery, religious and spiritual concerns, racial trauma, substance use disorders, and multicultural concerns. She currently runs a therapy group for Black identified female students at UCF, serves on the trauma-informed care system at UCF CAPS, and is faculty advisor for UCF Active Minds. Tamara has a passion for community outreach and raising mental health awareness in underserved communities. Ms. Anne-Marie Palmer is a graduate from Rollins College with a BA in Psychology and Religious Studies and a graduate at the University of Florida. Go Gators. With an MA in Religion and an ME, I guess that's a Master's in Education?
MED.
Yes, MED. Specializing in student personnel in higher education. Ms. Palmer has been at the University of Central Florida since 2011, where she started her career at the Office of Student Conduct. In 2012, Ms. Palmer started her role as a case manager with student rights and responsibilities, working with students experiencing mental health distress. Since 2012, she has expanded the case management services into student care services, with a staff of student care coordinators providing wraparound care for students in distress related to mental health concerns, personal or financial challenges. She currently serves as the Associate Director for Student Care Services and oversees coordination of care for over 2,500 students for each academic year. Whew, that's a lot. That's a mouthful. Thank you so very much for coming here today, or being available today for the students or faculty or staff that are viewing this Zoom webinar online. We've got quite a few participants online, and hopefully we'll be able to answer many of their questions. And before we do that, I want to give everybody the opportunity on the panel to maybe add something to, or maybe subtract. Hopefully all the information was correct, but I want to give everybody the opportunity to maybe add a little bit from what I just provided. So Dr. Moore?
Sure. Thank you so much, Representative Silvers, for hosting this important town hall. I think, as you mentioned, we've been doing these across Florida for the past 6 months or so, and I think they're really informative, not just for our college students, but also for faculty and staff to get a little bit more information about resources that are within your institution as well as within your county and surrounding areas. We know that our college students are so important to all of us, and we really appreciate your passion with mental health issues, both with children and adults. So hopefully at the end of our town hall this afternoon, we hope that you have a better understanding of mental health issues as well as addiction, and a little bit more about some of the resources that are at UCF. Just a little bit more information about FMHI. Some of you might not be aware of the Florida Mental Health Institute. We've been around for over 45 years. We were legislatively mandated, and as Rep. Silver said, we do a lot with policy, both within the state as well as nationally. In 2008, we became part of the College of Behavioral and Community Sciences, but with still the mission in mind to do work on substance use, mental health, and child welfare issues. So I became the director 2 years ago and have done quite a bit of work in this area already, but we're really expanding to try to continue our work with state policy and working with NAMI, the National Association of Mental Illness, to try to reduce mental health stigma, which we know is a really big issue, and hopefully we can talk a little bit about that today, ways to really open up the dialogue, which is one of the reasons why we're doing these town halls, is to have a conversation. So I look forward to that conversation with our students, with our faculty, and employees.
Thank you very much, Dr. Moore. Dr. Hoffman, do you want to add anything?
Sure. I just want to thank you, Representative Silvers, for having a platform to talk about mental health. Since I've been a director since 2013, mental health and students coming to counseling, we have had about an 85% increase. And I know that sounds a lot, 85% since 2013. So mental health has been on the radar and on the landscape of our Florida and the national landscape. It has become an issue that I think this generation has put out there to be able to talk about. They are reducing the stigma. They talk about it on social media. They're talking about their mental health more than any other generation before, and so we're glad. But I think it also comes to light that that students are struggling, and we knew this already, but now we're all kind of trying to figure out how best to serve the mental health needs of college students prior to COVID-19. And now COVID-19 has put a new slant on how mental health services and mental health distress has impacted all of us, certainly, but our colleges, really with being in more of this telemental health platform, but still having all the expectations of academic stresses, financial stresses, and a lot of times physical stresses of your physical health. So this is a great platform, and I look forward to the questions.
Thank you. Dr. Jacobs.
Sure. Yeah. Thank you for, the intro, Rep Silvers, and thank you for inviting me to participate today and for being part of the panel. The intro was pretty, comprehensive. The only thing I'd add is that I've been here at UCF for about 1.5 years now, and I love it. I love being part of the UCF family. I work right here out of the health center on the main campus in the building, displayed right behind me. And it's sort of a multidisciplinary building. We have primary care, sports medicine, substance treatment, within behavioral health, dietitian, physical therapy, pharmacy. So it's a kind of a pretty comprehensive health center. And I hope to be of, some help today. And I really look forward to, today's discussion and to any questions that might come up.
Thank you for being here. Ms. Nelson?
Hey, I don't have much to add, but I just want to thank you for the opportunity to be a part of this conversation. And I'm also, as everyone else mentioned, looking forward to just the questions that come up. And it's a very important topic. So I'm just happy to be here.
Thank you. Thank you for being here. Ms. Palmer.
Yeah, I'm also appreciative. Ever since our institution had gone remote in a lot of our operations, our area definitely saw an uptick in students reaching out, either overwhelmed or kind of unsure of next steps and where to go. And so we do refer and work really closely with all of these great partners here today. And, we are a large institution. There are a lot of great resources and support options available, but sometimes it can just be difficult to navigate. So having, opportunities like this to talk through them is great. And then at the end, we'll be able to talk a little bit about how students can take the next step. So really appreciative of that.
Well, thank you again. Thank you very much for being here. And we do have quite a few participants online. Now, before we get to any questions that the participants provide live, we did have, I guess we sent out an email and we received some questions beforehand. So we're going to answer some of those questions and we'll go from there. Is everybody ready?
Mm-hmm.
So I guess I'm gonna pose this question to Dr. Hoffman. How can we help students from marginalized communities like low socioeconomic status and with behavioral health in the time of COVID?
Well, and I'll answer this question, and I will also invite my colleague Tamara to talk about that as well. But as we know that COVID-19 has negatively impacted marginalized communities, especially Black communities, we know that the losses have been higher in those, and then add a socioeconomic status there. And so I think about COVID and the grief and loss that we have all experienced, and then thinking about the marginalized community, that this has impacted them more. And we've had unprecedented times with racial unrest and the death of George Floyd and Breonna Taylor and many others, that I think what we call the racial pandemic. And so this has increased trauma, racial trauma. I think our marginalized communities and Black communities, Black and Brown communities, live with being impacted by racism every day. But this has probably brought this to the forefront. And I think we've seen these communities impacted, an increase in depression, anxiety, coping. And what we hope is that the resources are there for our college students. Tamara is leading one of our groups that we have, and we have other groups of support. But my hope is that the stigma of reaching out and getting help, because we also know that there's some stigma in these communities about getting mental help, but there are spiritual leaders. So I hope that there is openness to talking about how this whole time period, the era of COVID, has impacted them, to be able to talk about what's happening.
Yeah, and to add to what Dr. Hoffman was saying, this time of dealing with both a pandemic and then with a lot of the racial injustice that have come about during this time, which again, as mentioned, has been happening. Like, those of us of color have been dealing with this our whole life, but with the attention that has been kind of zoomed in now, because we're in a time where we're more still, and a lot of other people who may have not noticed are now paying attention. There's a lot of stress, grief going on. I run, as mentioned in my bio, a group for Black women, and I've also been one of the 3 faculty members who have been running a open discussion group for Black students to have a space to talk about everything that's been going on, because we understand that those students in particular, they may not have those outlets in other spaces. So there's just, from my experience with working with Black students or those affected marginalized groups, there's just a lot of mixed feelings, anger, depression, anxiety, not feeling safe in their own skin, being traumatized by what they're seeing in the media, all of the videos with police shootings. And so it's just a lot to take in. And then some students have expressed like no one checking in with them or asking them how they're doing during this time, which is why we felt it was important to provide these spaces for those students. So yeah, it's a lot going on with the 2. And then COVID-19 has disproportionately impacted marginalized communities as well, which still affects, our students. They're not separated from general society in that as well.
There was a question actually at I think it was the FAU town hall. Kathy, I don't know if you remember it or not, but a couple of students had actually asked a question. I guess that would directly, maybe you can answer this, Ms. Nelson. There was a student. She indicated in the Q&A portion of the when she asked her question, she said, I'm female and I'm African American. I want to know if FAU will be hiring African American doctors or behavioral health professionals. I feel more comfortable speaking to an individual who understands from where I'm, my background. And I posed that question to the individual, the panelists from FAU, and they said they were in the process of bringing in people from all different backgrounds, whether they're African American or Hispanic, to better assist with behavioral health within that FAU community. Is that something that's been brought up with the UCF community?
Yeah, so from students, it's the same experience here where, I have involvement with student organizations on campus as well, and they will express, make comments that I'm not going to come to counseling unless I can work with someone who looks like me, because I feel like they're not going to understand my experiences. So it definitely is that representation is critical. And also with there being a lot of stigma in those communities, they need to see a face that looks like them. So on our website, we have all the pictures of all the staff members, and a lot of them will come in and specifically request to work with, there's myself and 2 other staff members who are identify as Black, and we get a lot of those specific requests because that just shows the importance of it. And I'll let Dr. Hoffman kind of comment on that as well, since, you know, I'm not in charge of the hiring process, but as a therapist of color, I definitely know the importance of having that representation in staff.
Mhm.
Okay. Thank you. Dr. Hoffman, did you want to elaborate on that, or?
Well, I agree wholeheartedly that representation is important, and so hiring a diverse staff that mirrors your campus is vital. And I think that as CAPS, and I'm sure all our other areas try to do that, because it's just for the same reasons that Ms. Nelson said, is students want to feel safe, and you know, sometimes the foot in the door is knowing there's somebody that looks like them, that might understand them, and that's what will get them through the door. And if you have a very non-diverse staff, you're not going to get everybody to come to your services.
Mhm.
Makes sense. Thank you. Have a question for Dr. Jacobs. And I actually have 2, but they may be kind of related. What are healthy ways to cope with anxiety from being away from your family? And so I'll let you address that first.
Okay, yeah, sure. And so I know, you know, it's always hard being away from family, but especially, you know, now during, you know, periods of extreme stress, you know, including the global pandemic. And so, but one of the good things about, you know, today's society is, even if you're not, you know, physically there with your loved ones, there are ways of staying connected. You know, of course, what we're doing today, you know, telehealth, well, so this isn't telehealth, but technology with, you know, with audio and video, you know, over Zoom, Skype, FaceTime. There's so many ways to be able to engage with your loved ones. It's maybe not quite the same as physically being there, you know, with that person, but it is, you know, still a way where you can see them, you can, you know, see their reactions, you can talk to them, you know, really at any time of the day. Same with phone calls, you know, text messaging. So I think it's super important, you know, always to stay connected with your loved ones, but especially now under, you know, periods of extreme stress. And kind of ways of coping with the anxiety, you know, I guess that's kind of similar to coping with, you know, just, you know, overall anxiety. I think I'm a big believer in self-care. You know, I think it's very important just to, you know, take good care of oneself in terms of, you know, having routines, making sure that you know, get 7 to 8 hours of sleep at night. Exercise, you know, could be extremely beneficial for anxiety. You know, regular, you know, cardio or lifting weights could actually kind of release some of what we call the endorphins, or kind of the feel-good chemicals in your brain, and that, you know, helps with both mood and anxiety. And it's important for everyone to have, you know, certain coping skills that they turn to under times of stress, and that could include things, well, exercise being one, but reading, you know, writing, meditating, listening to music, practicing deep breathing. You know, any of these coping skills can kind of sort of help to regulate and decrease one's level of anxiety.
I mean, and then this is the other kind of the other question that I think leads right into this. Do you think diet has anything to do with it?
Diet, yeah, diet absolutely, you know, does, you know, factor into, you know, one's mental health. It's sort of a very complicated area, and I don't think it's completely understood yet. It's being, you know, studied and researched, you know, as we speak. But you know, the brain and spinal cord, that's kind of what's called the central nervous system. The gut kind of has its own nervous system called what's called the enteric nervous system. And there's a connection between the two, between the brain and your gut, through what's called the vagus nerve. And so it sort of, you know, explains to a degree kind of the relationship that goes both ways, you know, brain influencing the gut, and gut, including what you eat, influencing your, you know, your mental health. And one of the, you know, main, what we call neurotransmitters, that's kind of like a chemical in your brain that plays a role in mood and anxiety and sleep and appetite. So there's, you know, a certain amount of it in your brain, but there's an even bigger amount in your gut. So it's kind of another, you know, means of how the brain and the stomach, or your, you know, enteric nervous system are connected. So it's super interesting. It's a really, you know, fascinating area that's only now kind of is kind of clarifying, I think, the full extent of the relationship between your stomach and what you eat and your mental health and well-being.
Okay, I think that all makes sense. It all ties together. Ms. Palmer, is it possible to build a support network? Is it possible to build a support network while social distancing?
Yeah, I absolutely think that it's possible. I've watched and listened to students doing it in real time right now. We've had students start their college experience for the first time either this fall or during the summer. And with their classes being remote, students have had to get creative in finding ways to engage with each other, but there are still a lot of programs and events and activities going on out there that can be very safe. UCF is constantly putting out information about virtual programs happening that students can participate in remotely if they're not comfortable or able to leave their spaces, or they're actually taking their classes but staying home in their hometown. Clubs and organizations are still going on. All of our student services and activity agencies are still putting on programs and events. So it's just about taking that first step and figuring out where the information is posted and shared, because it's all out there. And we at UCF have very active social media accounts for all of our different programs and services. So it's just about kind of reaching out into one space and finding out, hey, what's going on out there? And I promise that information overload will happen because there is so much. It's just about taking that first step to choose to engage. And of course, there's a lot of outdoor activities and different things happening in the Orlando community that can be a safe practice and can be still enjoyed very well. But definitely encourage students to just start by following some of the different student activities and student event social media accounts, and they'll really be able to see all the different ways they can continue to stay engaged, even if it's not that traditional activity or program that they were thinking about.
Mm-hmm. And Rep. Sills, I'll add to that. I think I agree, Ms. Palmer, that those are great things. And I think, incoming freshmen, I can imagine that the college experience looks really different than in terms of the landscape than it has in the past. And so, to encourage students that are coming on campus for the first time to do as much normal activities as possible, and whether they're taking classes virtual or they're taking some live or a hybrid combination of both, to be able to get that college experience where it's not just taking academic classes, but it's really doing those other social events. Like you said, I think there's a lot more now on the virtual platform that students can experience. So being able to reach out and do that is really important.
Thank you. Thank you for adding that. There was a question that popped up live. I guess we can go to it. It's a little off topic of what we've been discussing, but it is behavioral health. It is mental health. And whoever wants to take it can run with it initially. In my late teens appear to have seems to be the age of when mental health or behavioral health issues may begin. Decades ago, when I was in college, there was a rash of suicides or suicide attempts at my university. What has research shown about mental health showing itself for the first time in young adults? Dr. Hoffman, you want to jump on that, or Dr. Moore, Dr. Jacobs?
Yeah, I think we all probably have a piece of this from where we sit on college campuses. From the counseling aspect, I would say a lot of our students, probably in the last 8 years, already have come with mental treatment or on medication already. So, in my 25 years in college mental health, I would definitely say students are starting younger to get mental health treatment and to, start therapy and medication. But I would also say that like probably decades before, college is a time where there's an increase in stress, and you do see an increase in, let's say, bipolar disorders or psychosis, because there is not a lot of structure. The stress levels of academic excellence students feel, and all of that stress and managing kind of being on their own can increase mental health issues of anxiety, depression, suicidality that we do see in college students.
So if you're online and you're watching this, and you may know somebody who maybe has mentioned, like, there, it's actually goes right into this question of, if you have a friend that maybe jokingly says, "Oh, I'm going to, hurt myself or kill myself," or some other threat, what can you do? And I just thought, I'm going to pose that question to you, the panel, but also if you are local to the Orlando area and you do have a friend that does say that or does something like that, there is 211. There is 211 in Orlando, correct?
Mm-hmm. Yes, there is.
Suicide Prevention Hotline and NAMI. So the question is, what does one say to a teenager jokingly saying, "I'm going to kill myself," or some other threat? What's a simple thing? What's a simple thing you can do to help save that person's life?
Well, you never take that lightly. And even though a person might say it jokingly, you can say, well, I know you were saying that you were joking, but I want to just follow up and say, are you seriously considering hurting yourself, killing yourself? Are you having suicidal thoughts? And it's important to say the words suicidal thoughts, because you want to be clear about what you're asking and you want to get a yes or no. Because sometimes hurting yourself can mean different things to different people asking. And somebody might be joking, but many times we hear from students who have attempted that nobody asked them, and they were just waiting for somebody to ask them about their suicidal thoughts, and nobody did, so they ended up believing that nobody cared.
Mm-hmm.
So,
That, I think, Dr. Hoppin, it's a really, it can be a really difficult conversation, a really uncomfortable conversation with your friend or loved one, but a really important one. And being able to say, are you thinking about hurting yourself? And then if your loved one says yes, being able to know the next step. You're not, most people are not clinicians, right? So being able to know when to pass the baton and to say, here's, I'll take you, let's go to the resort, let's go to the counseling center, let's go to the ER. It is important. You are potentially saving a life. I'll just say one thing we're doing at USF is we're teaching mental health first aid to all of our undergraduate students. I think it's a great resource, and we go through that exercise of how to have that conversation. So I think the more that we can converse about it, reducing that stigma and that uncomfortableness, the better for all of us.
And I'd like to say, I'd just like to add, you're not alone in either side of that process. We get calls every day from a concerned friend or family member or roommate, and they aren't sure what to do or what the next steps are. Or we get calls from the student themselves that might be in that critical situation. So this is not an uncommon thing. And it really is just a matter of, it's okay to reach out and ask for support. If you're not sure or you're nervous about calling CAPS or the police, or kind of knowing, do I take somebody to the hospital? It's okay to just reach out and ask some of those questions, because there are plenty of professionals on our campus community that know the answers and can guide you and direct you to that support as the concerned person. And like I said, we see this every day at Student Care Services, and a lot of times, we do have to call and ask somebody to check on a student and intervene. And we're thankful we do, because they get the help that they need and they can get themselves back on track. But it just takes that kind of initial first step and a little bit of that courage to get connected.
So while we've been talking about this one item, someone actually, an attendee just posted something that I think I should bring up. I noticed some social media posts from my child which implied that he could be a little sad or depressed. He claimed he was just joking, and lots of people post stuff like that online. I told him that I was concerned, and he said he was fine. His sister, who is a senior in high school, also said people joke like that on social media. When do I get concerned? And I want you to know he didn't threaten to harm himself or threaten suicide. Okay. So, Dr. Hoffman, do you want to take that?
Sure, and anyone else can jump in as well. So, and I have kids as well, and we worry about them. We're parents first before we probably are mental health professionals, and they're in school, and I've been worried about them and how they're managing. This has been a big change, and I know parents who have little kids and who are not seeing their friends, or are not managing their academics as well online. So I think it's normal to be concerned. We need to check in with our kids, and maybe not wait for them to say, but just ask them periodically, how are you doing? This is hard, and validate the feelings, because it is hard. It's normal to feel that this is hard. A pandemic is not a normal situation for any of us. And as human beings, we are hardwired to connect and be close and be connected. And this distance has been difficult in many ways for all of us and our kids as well. So I just say continue to ask how they're doing, or say, hey, I notice you're sad or you're struggling with this. Tell me, and so open the conversation. Almost assume that it's difficult and have them convince you why it's not.
You think that okay, so you're the parent, you're asking your child, how they're feeling, how they're doing, constantly checking in on them. There's no stigma associated with you, but do you think your child could have that stigma maybe from their classmates, and then they don't want to open up because of that? Could that be an issue?
Oh yeah, I mean, I think especially given the developmental age of the child, they're going to have much more inhibition, or they want to be accepted by their peers. So, they don't want to look crazy or feel like they're any different or needing mental health or whatever the stigma is. And that's why I think you have to normalize it as a parent or as a friend or a colleague to say, yeah, I'm struggling. It is normal to struggle. And so that you can see, is this something that, I can talk with you, or we can talk together and we can feel better, or is this not changing? If you talk about it and it doesn't change, you may need a little more professional help to kind of help you along. And again, we all need it. We all need it at some point in our life. How do we have the conversation that therapy can help everybody, and no one's immune to not needing some support or help at some point. And at this point during COVID, I think many of us could use a little help talking about it with our friends and saying, I'm really struggling, or maybe getting some professional help.
Mm-hmm.
Do you think that maybe, whether it's, since I went to the University of Florida, and when I went to the University of Florida, there was it was something called preview before you started your freshman year. I don't want to assume anything, but does UCF have something like that before the school year starts? What if you implemented something like that, part of your preview program that talked about mental health, so it got it out in the open? I don't know, is it available right now?
Yep, there's education on mental health throughout our orientation process. So we have a very similar orientation model to the other state institutions, and students get a lot of in-person and virtual education on that. Of course, the first few weeks of any student's college career is also difficult because they're on information overload. And so kind of thinking about mental health is probably on the bottom of their list. A lot of times they're worried about who's my roommate, where's the food, do I have my books? So we do programming, and so does health services and CAPS. We do programming year round, because this is typically the time of year that we see some of the spikes. Students have gotten settled into their classes, and now some of the other challenges start coming up. And so we've noticed over the years of us doing this type of work that students will look for this when they need it. And so it really does have to be available, quickly by searching or by asking a friend, hey, do we have counseling on campus? What are the resources? Because they typically won't do that research ahead of time. They'll look for it in that moment. So, yeah.
So it's just when they need it, it is when they start to look for it. It's not like, okay. Dr. Jacobs, are you seeing a lot of students are also skeptical of coming in for help, or because of any type of stigma?
Yeah, I do. I do see that a lot. Either, either people of, either the they'll say, they'll come in, saying that they've had these symptoms for years, but, either maybe, their loved ones or their family wasn't supportive, or their cultural background, wasn't really supportive of talking about mental health issues. As a psychiatrist, I do, use medication as part of my toolbox, and students come in kind of with all kinds of, preconceived notions about medication in general, but the stigma is absolutely still out there. And I always just, I'm always proud of students for, taking kind of the step to do, what they, in order to kind of do what they did to, come into my office to kind of, seek out, the referral either through a primary care doctor or by going to CAPS and being referred here. And I did want to add to, sort of what Karen was saying too about sort of the kind of when are you concerned, when are you not concerned. I definitely completely agree with always having, an open dialogue, that's super important. And kind of, as a clinician, one, other things that I kind of take into consideration, because of course everyone feels, down, from time to time. It's, a normal part of life. No one feels happy 24/7. Things that make me a little bit more concerned is if it's persistent, somebody feeling down, all day, every day for, a prolonged period of time, days, going on weeks, or if there's other symptoms that kind of go along with kind of feeling down, whether it's trouble sleeping, trouble concentrating, sleeping too much, appetite either too high or too low, feeling very fatigued. There could be kind of this whole other array of things that kind of give me more information as to kind of the severity of what's going on. And so just kind of some other things to look out for. And of course, if there's ever, mention or concern of suicidal thoughts, then it's always, I'd recommend, professional assistance. But I don't think, I agree it's always best to kind of err on the side of caution, and no one's going to ever, fault you for, referring somebody for, for an evaluation or for, even just for information to, to discuss, is this normal? Is this, extreme? And another kind of thing is if the symptoms are interfering with functioning, is it interfering with your social life? Is it interfering with your academics? That's kind of also gives you more information as to the level of severity as to what's going on.
Mm-hmm. I just want to add one thing about the mental health stigma piece. Something that we talked about before we got on this afternoon is the really the explosion of telehealth and telemental health. And I think that really does help kind of break down some of the barriers where you can have a conversation with your counselor, your therapist, virtually, and you can be in your home, and so you don't have to, breaks down that barrier of transportation issues. If you're not local, you can still connect with UCF resources, and so I think that's really important as we move forward to continue that telemental health avenue.
So, sorry, go ahead.
Well, and I want to plug two resources that you could use right now and don't even have to access any of our services. One, if you want to have the conversation of how do I bring this up, and that is our Cognito. I know the state institutions all have Cognito. You just have to search UCF Cognito, and we have it for faculty, staff, and students. Mm-hmm. And that is a avatar-based program where it'll give you scenarios, and then you have to pick the right response, and then it'll tell you if you got it right or how to say it better. So that's available right now. We encourage everybody to take that. And on the CAPS website, we have our therapist-assisted online self-help program, which is called TAO. And they are, again, web-based models for how to manage anxiety, how to manage depression, gives you concrete coping tools about what depression, anxiety is, and then how to manage it. Also about relationships, pain management, substance use. So if you're just wondering if you're, have an issue and you want some concrete tools, these are things that you can do right off the bat, right now, to access on our website.
Actually kind of leads into a question someone just posed. Actually is exactly what Cognito,
yeah.
At-risk module. It says more UCF specific. I know an SDES employee. What is SDES?
Our division, Student Development Enrollment Services, kind of student affairs division at UCF.
Thank you. They had to complete the Cognito at-risk module. Is that something other departments are encouraged or required to complete? I guess that kind of.
Yes, yes, we would love, if we could have all UCF staff, faculty, and students do it, we would be so happy and excited.
How
It was a requirement at the health center as well for staff to complete the Cognito training.
how many students and staff on an annual basis fill that out, complete it?
It's Cognito, are you
Yeah.
saying Cognito?
Cognito.
This is actually the first year that the states have had it. So I think we're up to 6,000 staff, faculty right now. And so I think all the states are,
Right.
for the Board of Governors are trying to get everybody to do it for this mental health awareness, so that faculty, staff, and students are more comfortable on how to have that conversation that can feel difficult.
So
Right.
it's only currently at UCF?
No,
It's within the whole state.
Oh, it is the entire state. Okay.
FSU has it, UF, FAU, USF, Florida Gulf Coast, like, so all the state institutions. The Board of Governors was a recommendation that we all get that and make available to our staff and students.
What's been what's been the response?
I think those who actually complete it really enjoy it. It's a fun activity. I mean, it's not this boring webinar that you're just listening to somebody. It's very interactive, and you get feedback and you see how you're doing. So I encourage everybody to do it and to try it. There are 3 modules and 3 different scenarios.
Can you explain what like one of the modules?
Yeah, so it's maybe a staff member, and so the avatar gives you, it starts talking to you, and so it says, yeah, I'm having some difficulty with my relationship, and I'm not doing well. And so then you have to respond. You have to find the response just to keep the conversation going. And so if you pick a choice that kind of made the conversation stop, it'll tell you, well, maybe this might have been a better choice. So, and you can do it in the privacy of your own office or home, and complete it yourself. And it's a great product.
That's great. But I guess we'll be able to. You said since this is the first year, you're not going to be able to really analyze the information, I guess, until you have a couple of years worth of data.
Yes, I think the Board of Governors are meeting in October, and probably are going to see how many staff and faculty have completed it so far, and then see if there's any impact on that, if there's increase in referrals or increase in conversations. And and that's what I would like to maybe share also, if there are any faculty listening today, is that many times before we ever see a student, the faculty or staff, like staff advisors or faculty, especially now in this Zoom, may not be showing up to class, may keep their camera off, they're not turning in assignments. That's when a faculty member can maybe see, hey, I've noticed, and then share the behavior that is concerning, and to see, how are you doing? I'm concerned. And then to start that conversation, and then to have a referral to one of our offices, student health, care services, CAPS. But it's important to start recognizing what the signs are that a student is struggling, and then to be able to refer them. They don't have to be counselors. They just have to know what referrals are available on campus, and then to connect them to the appropriate referral.
Okay. Seems like a great resource, and it will help get the right help to the individual in a quicker manner.
Yes, and so it's hard to know what's out there. I mean, UCF is so big, so we always say start with student care services first. They really assess the whole person, and so a student may have some depression, but they may also be having financial stress, or maybe they've, lost their job and they're about to lose their housing. And so student care can assess all of the stressors that are happening and then make all the appropriate referrals to the resources on campus. So sometimes just starting with student care services is the best bet.
Mhm.
Right. I think we'll have some of those slides up at the end too, so everybody can get the information on how to connect and kind of start that process.
And I just wanted to add to that, Dr. Hoffman, that sometimes, as you said, the faculty member, the instructor may be the first person that really recognizes that there may be some issues. And so for faculty and staff to really, for them to be comfortable to make those connections is really important. So I think the courses that we have to get that information and to be comfortable having a conversation with somebody. Again, we're talking, a lot of these classes are virtual now, and so being able to have that conversation and recognize some of the signs and symptoms, where you said somebody's not putting on their video camera, somebody's not engaging in conversation, they're missing class. Those might be some signs or indicators that you might want to reach out and ask the student how things are going.
Yeah, and maybe you can share, Ms. Nelson, maybe what you are hearing students saying.
Mm-hmm.
Yeah, so currently a lot of what, in terms of like struggles during now with academically, I have a lot of clients that are struggling with the transition to remote classes because they may have different learning styles and that may not be fit their learning style. And so there's a lot of stress with that, feeling like they're falling behind in classes, having a lack of motivation. So maybe because the class is remote and they're not in person, they don't feel that same level of engagement. So sometimes they just don't have the motivation to engage. They're dealing with their own maybe mental health challenges that have been kind of exacerbated because of the pandemic, or they have family members who have died because of COVID-19. So they're dealing with a lot of different added stressors and grief, and then it's hard to focus on schoolwork on top of that as well. I have some students that are dealing with financial challenges. They may not have family members who can help them financially with rent or with tuition, and now with not being maybe employment, they're not employed or they're lost their jobs. So there's a lot of added stressors with that. So that's a very common thing I've been hearing with my clients, is just really struggling academically for those reasons.
I've heard a lot of that too, Ms. Nelson, what you said about students reporting kind of having low motivation to keep up with their online classes. And as you said, it could be because it might not, suit their particular learning style. They might, just prefer the, physically being in person in the classroom, and other classes might be online. One thing that I found helpful and kind of talking to the students about is I really encourage everyone to keep a routine to their day, keep a schedule and keep structure. I mean, because sometimes I'll have students come in saying they're, staying awake until like 8 a.m. and then sleeping until like 4 p.m. So I really encourage people to kind of, be consistent, go to bed around the same time every day, get up around the same time every day. And I encourage them to sort of, kind of have different blocks of time during the day to focus on specific classes, as if their class was going to meet, say, from 2 p.m. to 4 p.m., then reserve that time, when the class would meet on certain days, to focus particularly on that specific class, just to help, stay on top of everything. That way it can kind of help prevent students from falling behind, because that's when they can sometimes feel overwhelmed. If a couple weeks go by and they haven't done any assignments, then they come in with a lot of anxiety about about everything. So I really encourage people from the beginning to be consistent, keep this structure, and sometimes that can help you stay motivated and to kind of stay on top of everything.
A lot of times we see students that have kind of exhausted all of those options. The semester's kind of progressed and gotten away from them. And we want those students to know that doesn't mean that it's all a wash. There are still ways to get back on and get reconnected and re-engaged, and we navigate students a lot of times through some of those last minute options and help advocate gently, or help students learn to advocate for themselves in those moments and learn to talk about their mental health in a way that helps their support systems can understand how it's been impacting academics and personal issues and finances. And then the university also has some measures in place if that semester really isn't salvageable academically, where we can, connect and support that student, and it doesn't have that long-lasting impact on their transcript or their finances. So they just have to reach out. And a lot of times, our health and our counseling referrals make their way over here where we can get them connected. And so that's why knowing about each other's services is also so essential.
So we've spoken about this before, and I guess before we went live today, but there is an available telehealth. A lot of people have submitted those questions. It's available. People, if a student doesn't know about it, hopefully they'll know about it now. If they're not watching it, maybe their friend will tell them that they can get the services through telehealth as well. Now, we're almost at 2 o'clock, so we'll probably be wrapping it up soon, but I do have one last question I want to pose to the panel, and I wanted to know what your thoughts were on virtual socializing, and how does one, if you are identifying a peer that may be having, maybe suffering some distress or some type of mental issue may be coming up, that what's one of the red flags, and what can you do? Dr. Hoffman, I'll let you take that. Is that okay?
Yeah, sure. Well, let me just say that Zoom fatigue is real. I say that it is the next best thing. If we can't be together, that Zoom is better than a phone call or texting. So it is more of a level of intimacy that we can see each other face to face, and certainly it has been such a help to be able to still see people individually. Group therapy, I had not done telehealth before this pandemic time, and I didn't know what to expect. I was even a bit skeptical. So I was very pleasantly surprised that it is really just as effective as individual in person. But I also know that people have preferences, and some people are wanting to see your therapist face to face. So right now, and because maybe you have a roommate or your Wi-Fi, so know that although CAPS, UCF CAPS is doing telemental health primarily, if you don't have a private space, you can come to the center, and we do have telehealth rooms that you can use, because right now safety is primary. We all want to have everybody safe, and so that's why we're still doing telehealth. And at some point that can change, but I also think telehealth is here to stay. People have preferences because of location, and I'm glad this is an option for students. But I also think that, we can connect by social distancing and wearing masks. So if this is not good enough and you need to see somebody in person, as far as friends or connections, just do it safe. I think that we can do things safely with social distance for our social connections. But safety, I think, is the primary purpose. And so I think there is both telehealth and video Zooms and for connection, for social connection. But right now, from our UCF CAPS perspective, we're trying to do this all through telemental health.
Thank you. Dr. Jacobs, want to add anything to that before we go?
Yeah, in terms of services at the health center, we do a mix of both. Telehealth is absolutely an option for students who either are far away or not in Orlando. Primary care has appointments over telehealth. Behavioral health, our substance clinic, we have appointments over telehealth. And we actually do have in-person appointments here in the health center as well, for essentially every service. Primary care has appointments where you can, if you say you need a physical, you can make an appointment just by calling the main health center number, ask for a primary care doctor, and they will, be able to coordinate that. And then behavioral health appointments, it's the same. We give the student the option of either in person or telehealth, depending on the student's request. And so it really is up to the student. And of course, we do use, safety precautions here. Everyone, who is coming into the health center is screened for COVID symptoms in advance. Everyone, is asked to wear a face covering, to the center. And then, of course, we utilize social distancing and hand disinfection while inside the building.
So,
go ahead.
So if someone wants to come in and face to face and get help face to face, there will be protocols in place to make sure that they're protected.
Absolutely.
Okay. Well, I didn't mean to cut you off. If you were finishing, I apologize.
Oh, no, that was essentially it. And so, yeah, we do, utilize the social distancing within the health center, and there's signs everywhere. And then even within the offices, just the physical seats are far apart. And the provider too, will be wearing a face covering as well, of course, in order to keep the students safe.
Okay. Any last comments? Any closing remarks, Ms. Nelson, Ms. Palmer? Sorry, Ms. Nelson, I'll let you go. I didn't mean to cut you.
Oh, no, you're fine. No, I guess in closing, I just want to encourage any, students that are out here watching this. Definitely, if you're considering needing any level of support, please reach out to us. You don't even have to make a commitment. You can even just call if you want to ask questions about counseling. So just want to let student body know that we're here to support.
What's the phone number if they're watching online that they want to write down?
Yeah, so the phone number is 407-823-2811. 407-823-2811. Our website is caps.sdes.edu.
Okay.
Is there a way to share our?
I believe that's going to be in the resource slide at the very end, but in case someone wasn't staying out for that. Is that what you were talking about, Dr. Hoffman?
Yeah, it just is, shows just all of the services that we are having, that our crisis line, we have students here have access 24/7 to a therapist. So our after hours is they just call our number and then press 5. I also encourage students to look at our social media. We're posting helpful information constantly. We post at least 2 times a day, and we have YouTube. So mindfulness, relaxation, I think anxiety is really high right now. So through TAU or through our social media, we have a lot of mindfulness videos students can access. And just know that you don't have to be a client. You can come one time. We have single session consultations. So if they just need some information or they just don't know if they can come one time, and that's fine too. So overall, I think so many students are struggling, but they don't know they're struggling because they see everybody being normal and going about their business, and they think, oh, something's just wrong with me. I want to just kind of say that probably everybody is struggling, but it looks like everybody is doing fine, or we should all go back to normal when we're still in a pandemic. So in question, just reach out, call us, have a consultation. I think just to see, and if it's only one session, that's great. That's all you need.
Got it.
I wanted to just add that too, sorry.
No, that's fine. Thank you. Ms. Palmer, any last closing remarks?
Yeah, again, I think there are a lot of resources here to navigate. One way to kind of get started engaging with them all, and I know it will be on the slide at the end, but just you can visit ucfcares.com. We try to make it easy for students. So ucfcares.com, you'll have all the information about behavioral health, CAPS, our wellness areas, our recreation programs, all the different self-help support. And then there's also a lot of resources there about other wellness and safety measures for students. So it's a great place to just get connected and start to kind of see what's out there and get connected to all the folks that you've seen here as well. And then we also, through UCF Cares, have some very active social media accounts, specifically the Instagram and Facebook accounts. We post regularly. We have live chats on there, activities, lots of things happening. So if you're not sure, that's a good place to start.
Mhm.
Thank you. Dr. Moore.
Yeah, well, again, thank you for hosting these forums. I think they're really informative, and I think just expanding the awareness about mental health. We didn't really talk too much about substance use and addiction, but we know that that was also on the rise over the spring and summer. And so if you are having issues related to addiction, whatever that might be, the counseling center will also be able to address those. And I just also wanted to mention, if there are parents that are listening to this forum, that there are resources that we're going to share, not just internal to UCF, but also outside within the Orlando area and Orange County area. So there's lots of resources that are available. And, I think, as Dr. Hoffman said, what is, we could all be walking around with a smile on our face, but we don't know what's going on inside. And so I think for all of us, we're all struggling at some point in terms of how to deal with this kind of new normal. And we could all use somebody to talk with, whether that's one session or coming in and saying, I really need to talk through some of these things. I'm really struggling with some anxiety or depression. So having them available is wonderful. And I'm glad that there's so many options that students and staff can have within UCL.
Well, thank you. Well, thank you all so very much. Thank you, Dr. Hoffman. Thank you, Dr. Moore. Thank you, Dr. Jacobs. Thank you, Ms. Palmer. Thank you, Ms. Nelson. I think it's been a very informative panel, Zoom webinar. You're a great panel, not an informative panel, you're a fantastic panel. And you've provided so much information to those that have been watching this online. If you're a student or if you're a parent or if you're a staff member and you need help, there are resources out there. And this, I guess, hopefully will bring mental health to the forefront and part of the dialogue, and hopefully remove that stigma and get the help for yourself or a loved one or a friend sooner than later. Mm-hmm. So thank you very much for all of you for taking the time, being part of today's panel, and also everybody online who participated, provided questions beforehand, provided questions today live. So thank you again. I truly appreciate it, and taking the time. And for those online, there will be a resource slide right now where you can get some phone numbers, email addresses, websites for different resources for behavioral health. Thank you so very much.
Thank you so much.
Thank you.
Mm-hmm.
So should we